humanity. Hope are well, fit, and living balanced life. And I hope you all are working hard. You all are following your day to Saturday. So again, I'm saying good morning to you all if you are live in front of me. So students, yesterday I told you regarding your practical notebook, because it will give you 30% marks. I hope you started this work as we discussed yesterday regarding practical file, regarding skills, physical fitness, regarding asana, I mean performance of yoga, you have to do there in front of examiner. Then regarding your, I am giving you reminder. Now our syllabus and on again chapter regarding various asanas, types of asanas, procedure of various asanas, how to overcome from diseases, and what are the benefits of these asanas for health, for our body, and what are the content of the asanas. We did so many things from this. As I told you, last content, back pain will come afterward, is not a part of this topic now. According to CBSE, you will not do this. I meant to say, it was in your syllabus. What? According to two guidelines from CBSE side, it is not a part of your syllabus now, beta. So we should avoid it. It's called back pain, not a part of your syllabus. Again today we will discuss about a very dangerous disease nowadays. It's almost in all over the world, and it's very old diseases. It's called diabetes. We will discuss about diabetes, procedure, benefit, contradiction of various asanas, those we can perform against diabetes. First of all, we should come to know what is diabetes. Diabetes is not a new disease for us. Diabetes is very old diseases. So diabetes is a disorder of carbohydrate metabolism, character, and presence of oxygen in the urine. Presence of oxygen in our urine. Diabetes develop when there is indication of of indication of insulin. So in simple ways, in other words, I will use simple words now. Diabetes is that when blood sugar level increase in our body. That is to say the presence of glucose or glucose in the blood is excessive than a normal limit. What require? It is excessive. This is called diabetes. Diabetes, there are types of type 1, type 2, type 3. So type 1 is the body does not produce insulin. Type 1 occur for the 40 years, often in early adulthood or teenage. Teenage means your age. Below 14, 30 to 40 years of age. Then, body not produce. This is one diabetes. Now we will explain type 2 diabetes. I mean second number diabetes. The body does not produce enough insulin for function, or the cell in the body not react the insulin. Your cell of body are not react to insulin. This is called second type. Affects female. This is mostly affecting female during pregnancy. Some women have very high level of glucose in their blood, and they to transfer all the glucose into their cells, resulting in progressively a rising level of glucose. This third type of procedure as well as benefits and contradiction for Paschimottanasana, Pavan Muktasana, Bhujangasana, Arth Matsasyasana, which cure diabetes. Procedure and benefits of these asanas I will explain in front of you one by one. So first of all, we will start from Bhujangasana. Bhujang mean just like snake. Snake, we can say cobra pose. When we are laying down, our neck up, this part is up. Then we can say we are on the hands, our weight on the hands, and we are on the this way. So Bhujangasana is also called the snake and or cobra pose. Cobra, you see, snake you see whenever they are doing, other body part is down and then the front body part is in the ear. This is called cobra pose. It form part of also we can say Surya Namaskar. It's also a part of, little bit part of Surya Namaskar. So the how to do it, how we can do it: lay down this way on stomach, and you see, lie with the help of stomach this way, and toe flat on the floor. Your toe flat on the floor, and place the palm of your hands down in front of your shoulders, shoulder level, this way. Touch elbow with the wrist, elbow with the wrist. While inhaling means we are getting oxygen. Then raise front part of body, raise your front part of body. Very slowly raise the head and chest arching this way, arch your chest and body. So backward without lifting the navel of the floor. So do close your eyes. You do close your eyes and stretch your body backward. Then it will be a very clearly pose of the this we can say Bhujangasana. Bhujanga means the snake pose, cobra pose we can say. Then holding the position, hold your body how much you can, depend upon you people. So this is called a cobra pose. This is a procedure. Then it can remove the obesity. 1 minute. Then return to normal position. Return to your normal position. So while inhaling or relax, this is called procedure of this Bhujangasana. So what are the benefits? Cure cold and bronchial problems. Improve abdominal shaping, kyphosis, obesity. This is very good for obesity. Bhujangasana, aids kidneys, liver, ovary function. It can help our kidney, our liver also. Liver will be very, very beneficial for that. Neck and spine gain in flexibility or strength. Your neck, your spine will gain flexibility if you people are doing Bhujangasana on a regular basis. Then next one is contradiction. Beta, contradiction means who will not perform. This is contradiction. Without advice of a expert, please don't perform it. It can very, very alarming for everyone. Not advice for people, those who are suffering from peptic ulcer, just like you are having hernia, just like you are having hypotension, hypertension and all, hyperthyroidism, you are having hyper, will avoid this. Not advice for those people, they will not perform. Those who are suffer from injuries to the back, shoulder as well as our neck. Those who are having any problem in back, in shoulder or any kind of injury or operation themselves, from, so they should avoid it. They will not do it. And most important is those who are pregnant women, they will also avoid it. Those who are pregnant not perform it. Then people with fractures, ribs, any fractures, backbone, ribs, wrist, should avoid this asana. If you operate, back pain, operate in spinal, then also you should avoid this. Then this was the contradiction of this Bhujangasana. Then beta, next is Paschimottanasana, back stretching pose. Paschimottanasana is a seated forward bend pose. Whenever we are sitting and we are touching our nose with the knees, and we will touch our toe. See, this is the name came from Sanskrit word Paschima, which means back will at the front. We will stretch our body at the front. So, which means intense stretch or straight, and asana mean pose. Procedure, how to do this, how we can do this. Sit and stretch both your legs forward and keep your toe and heel together. Then exhale completely from body, forward, and your nose, and hold the toe with the both legs, with both the hands. Hold your toe, touch it, grip it. So try to put your forehead on your knee. Your forehead, this portion, forehead, will touch your knees. So remain to this position as long as possible. Slowly come to your normal position. This is called Paschimottanasana. So what are the benefits of this asana, beta? The benefits of asana: stretch the hamstring muscles and increase the flexibility of your hip joints. We can check your flexibility, even we can increase your flexibility while doing this asana. It tones the masses, the entire abdominal and pelvic region, including the liver, kidneys and adrenal glands. It can help to increase the level of them, increase the flexibility of them. It stimulates circulation to the nervous and muscular of the spine. Then Putter, next is it cure gastric, ingesting and constipation. It control weight and obesity. Every asanas are doing same, but we are talking about Paschimottanasana. This asana, if we are doing and we are habitual to perform this, we can control our weight and obesity. So it is very, very beneficial for diabetic patient. Those who are having diabetes, they peoples are more beneficial for that. It is beneficial in the liver diseases, beta. Those who are having a liver problem, they can be a very, very in the beneficial mode if they are performing these asanas. Then next is contradiction. Beta, I repeat my words again. Contradiction means which peoples will not do this. So people who are suffering from slip disc, their disc problem. I have seen many cases they are saying I have disc problem. So better they should avoid this. This is a bending pose. In the bending pose, the problem, disc problem may be more dangerous if you will forward this. So hernia should not practice, and those who are having hernia in the body, so they will also not do this. Pregnant women also avoid to perform this activity. I mean this asana. So the next is Pavan Muktasana, leg lock pose. Lock your leg. I am sleeping now. I will lock my leg, and one leg, then second leg, then both legs. This is called Pavan Muktasana. Pavan Muktasana. The word Pavan means the wind. Wind means, see, wind we are running in our atmosphere. This is called wind. So Muktasana means release. Therefore, this asana is also known as wind or gas releasing pose. Gas, the body gas will come up. So it can be done on one leg or both legs, whatsoever we require and whatsoever our body composition is, whatsoever our body is allowing to do so far. Procedure: lay down straight, the rest of the right knee on the chest, grip your knees and touch with the chest how much you can. Then interlock both the hands, keep them on the knee while inhaling, press, and knee rest on the chest while lifting the leg. Touch the knee with the nose. This nose we will touch with the knee. Grip your knee inside and touch with the nose. This way we can do this asana. While slowly inhaling, return to the back position. Inhale, exhale. Inhale. Inhale means oxygen inside, and exhale means Matsyasana means fish. So Ardhasana also called half load of fish's pose. Mean Matsya mean in the Sanskrit word fish, fish in English, and machli in Hindi. So Ardh mean half, half pose of fish. So this asana named after yogi Matsyendranath, who found Hatha Yoga. On behalf of him, this name is Ardha Matsyasana. So procedure of stretch body, your legs forward and put your left leg on right thigh. Then this way you will bend this way. Then place your right knee on left side such as sole remain on the ground. Then hold your toe on the right leg with pointing left hand and take your right hand behind the waist. Turning your hand and neck back
vertical